Okay, now we start the cholinergic agents. Okay, these agents are also known as parasympathomimetics or cholinomimetics. Okay, these agents are called as cholinergic agents because their effect is similar to that of acetylcholine. Okay, their effect is similar to that of acetylcholine, therefore they are called cholinergic agents or cholinomimetics. Okay, so let's first discuss how this acetylcholine is synthesized. Okay, this is high yield topic. Okay, the synthesis of acetylcholine is a high yield topic. Okay, h y high yield topic. Okay, let's put a different color there. So high yield topic. It's a high yield topic. Okay, first choline. There is choline. Okay, the choline is generally uh, obtained by the body from the diet. Okay, it is taken inside cell through a transporter. Okay, at this point there is a transporter, choline transporter, through which the choline enters the cell. Okay, inside the cell there is acetyl CoA that has been derived from the Krebs cycle. Okay, that these two, choline and acetyl CoA, together in the presence of a cat. Okay, this is not an actual cat, it is choline acyl transferase. Okay, together they form acetyl choline esterase. Acetyl choline. Okay, this acetyl choline is packed inside of vesicles. Okay, they are packed inside of vesicles to prevent them from getting destroyed. Okay, they are packed inside these vesicles to prevent them from getting destroyed. Okay, once inside these vesicles, okay, once stimulus comes, then these acetylcholine vesicles will be released into the junction. Okay, this is the junction. Okay, this they will be released here. Okay, once the stimulus comes, or during depolarization, when this part is depolarized. Okay, when this part is depolarized, then acetylcholine is released. Okay, then acetylcholine is released. Okay, so during the release, okay, these vesicles, they have a protein called syntaxin. Okay, and this membrane, it also has a protein called synaptobrevin. Okay, so syntaxin and synaptobrevin. Okay, syntaxin and synaptobrevin. Okay, they fuse with each other. They fuse with each other, and this helps facilitate the release of acetylcholine into the junction. Okay, maybe be that neuromuscular junction or whatever. Okay, then the acetylcholine vesicles will be released and the acetylcholine will be out of there. Okay, one important point about the syntaxin and synaptobrevin protein is that the toxin known as botulinum toxin or Botox, available as Botox for medical use, this what this does is it digests away the syntaxin protein. Okay, the botulinum toxin will digest the syntaxin protein, and due to this, no acetylcholine can be released into the junction, thus causing paralysis. Okay, this feature is also used in the treatment of blepharospasm and dystonias, and obviously it is used to hide away or to remove the aging related wrinkles, especially in the face. Okay, and the point about synaptobrevin and syntaxin, both, it comes when we talk about black widow spider. Okay, black widow spider. Okay, let me clear this. Black widow spider. Okay, what this spider's toxin known as laterotoxin does is that this toxin increases the connection between this syntaxin and synaptobrevin. Okay, so they come together very fast. Thus, causing early release of acetylcholine. Okay, when there is early and continuous release of acetylcholine, the acetylcholine will get exhausted, and this will result in a state of cholinergic crisis. Okay, these are the 2 points. And about one more interesting fact about the black widow spider is, in its body, uh, in its belly, it has this shape. Okay, hourglass like shape. This is the defining feature of the black widow spider. So if you ever see this kind of spider, please run away. Okay, next we'll discuss about the mechanism of action of nicotinic and muscarinic receptors of okay, how the acetylcholine acts via the nicotinic and muscarinic receptors. Okay, we'll now discuss how the acetylcholine works through nicotinic receptors, both NN and NM type. Okay, the two most important points, if you want to remember about how these the acetylcholine works through this receptor, is that there is no any second messenger system. Okay, like we'll see how the muscarinic receptors, they have second messengers. Nicotinic receptors do not. Okay, these nicotinic receptors basically work by activating the sodium and potassium channels. Okay, okay, let's discuss this in a brief. But if you want to remember only two things, then these two are the points. Okay, when the acetylcholine comes and binds to acetylcholine binding site on these receptors. Okay, remember these nicotinic receptors are ion channels. Okay, these receptors, they are ion channels. Okay, then what happens is that it causes movement of sodium inside the cell. Okay, the positive charge is going inside the cell. That means the membrane potential or the charge inside the cell moves toward less negative side, from -90 to less negative side. Okay, once enough sodium has reached inside the cell, then threshold potential is reached. Then threshold potential is reached. Okay, so what is this threshold potential? Is that when voltage gated sodium channel opens, the potential at which the voltage gated sodium channel opens, then this potential is called threshold potential. Okay, now this causes depolarization of the cell and action. Okay, after this depolarization is has completed, then what happens is that K plus or potassium efflux occurs through voltage gated potassium channels. Okay, this results in, so K plus efflux, it causes repolarization. So this is how the acetylcholine works through both NN and NM type of receptors. Okay, next we will discuss about how the muscarinic receptors, how the acetylcholine works through muscarinic receptors. Okay, so now how acetylcholine works through muscarinic receptors. Okay, there is a slight difference between how it works through the M1, M3, M5 receptor and M2 and M4 receptors. Okay, first we'll discuss about M1 and M3 receptors. Again, as I mentioned previously, that the nicotinic receptors do not have second messenger system, but these muscarinic receptors, they have G couple mediated. This M1, M3 and M4 have GQ type, and these are second messenger system. Okay, let me change the color. Second messenger system. Okay, if you want to remember in shortcut, and if you want to remember only, if you only want to remember few, then remember that these receptors, they act through IP3, inositol triphosphate, diacylglycerol, and through increasing calcium. Okay, three things: inositol triphosphate, diacylglycerol, and increasing calcium. Okay, now we'll see it in a bit detail. Okay, so when acetylcholine comes, it binds to this receptors. Okay, and these proteins, GQ proteins, what they do is they activate something called phospholipase C. Okay, this phospholipase C instead acts on this. What is it? It is phosphatidyl ionoacetyl diphosphate. Okay, phosphatidyl ionoacetyl diphosphate. Okay, you probably guessed right now that this is converted into ionoacetyl triphosphate and diacylglycerol. Okay, these two. Okay, okay. What ionoacetyl triphosphate does is that it acts on the endoplasmic reticulum inside the cell, and as we know that endoplasmic reticulum has calcium inside of it, this ionoacetyl triphosphate or IP3 brings out the calcium from the endoplasmic reticulum into the cytosol. Okay, then what happens is that then the calcium dependent activities will start inside the cell. Basically what happens is that calcium will bind with calmodulin, forming calcium calmodulin complex. Okay, this complex will activate calcium calmodulin kinase. What this basically does is that they can phosphorylate other proteins and cation channels. Okay, meaning that there will be increased formation of other proteins and cation channels. Okay, these phosphorylation reactions, cation channels, cation channels. Okay, what this cation channel can do is that through these cation channels, cations can go inside the cell. Okay, then the cell will get electrically activated and depolarization will occur eventually. So once depolarization occurs, let's suppose example, if we were talking about a smooth muscle cell, then depolarization would have led to contraction of that muscle, and if we are talking about a glandular cell, then depolarization would lead to secretions from that. Okay, so basically remember ionoacetyl triphosphate, DAG, and calcium dependent activity. Okay, and remember these are second messenger system. Next we'll discuss how the M2 and M4 receptors work. Okay, so we continue with how acetylcholine works through muscarinic receptors, now M2 and M4. Okay, again these receptors they work through second messenger system. These work through G protein mediated, okay, GI protein mediated system. Okay, so what they basically do is that they decrease adenylyl cyclase. Okay, yeah, okay, again if you want to remember only few, again this is the most important, these two are the most important. Remember that this is again second messenger system, and they act by decreasing adenylyl cyclase, thus decreasing cyclic AMP. Okay, what the decrease in cyclic AMP does is that it decreases phosphorylation of ion channels, means less ion channels are formed, thus the calcium inside the cell from outside, the calcium not only little calcium will come from the outside to the inside of the cell, thus the cell is inhibited. Okay, this was a bit short explanation, but this GI protein has three components. Okay, alpha, beta, and gamma. Okay, uh, alpha, beta, and gamma. Okay, this alpha part does this action. Okay, this is mainly this alpha part is responsible for decreasing adenylyl cyclase and thus the following events. Okay, what these beta and gamma, what they do is that they go at the cell membrane surface, they open channels, and they leak out potassium through them. Okay, so dual action is happening, that the calcium is not coming inside of the cell. Okay, decreased calcium inside of the cell coming from outside, and the positive charge, that is potassium, is also being thrown out of the cell. Okay, thus cell is inhibited. Okay, one of the examples of this system is vagal mediated bradycardia inside of cell, inside of mainly AV node and SN node. Okay, in the heart. Okay, so when the AV node and SN node are in their resting point, calcium and sodium influx will occur. Okay, then what happens is that the resting membrane potential will go up to the threshold level due to this cation or positive charge influx. This will cause opening of the voltage gated calcium channels, thus resulting in depolarization. Okay, after the depolarization has completed, potassium efflux from inside of the cell to the outside will occur, resulting in repolarization, and thus this completes whole of the action potential. Whole of the process of one heartbeat. Okay, now what happens when these are stimulated by acetylcholine, or vagal stimulation is there? Okay, no calcium influx will occur, and furthermore the potassium inside of the cell will go outside, thus increasing the electronegativity of the cell. Okay, so the SN node and AV node will go into a state of hyperpolarization. Okay, from -90, for example -90, they will move further down. Okay, so it takes more time to reach the threshold, thus causing bradycardia. Okay, next, I think this is all about the mechanism of action of how acetylcholine works. Next, we'll discuss about the drugs, okay, cholinergic agents. Okay, now we'll continue with the cholinergic agents. Okay, basically there are two type of cholinergic agents. One, those act directly on the acetylcholine receptor, that are cholinergic agonists. They act on both nicotinic and muscarinic receptors that are present on the post-junctional area. Okay, and two, that act by increasing acetylcholine by targeting the acetylcholine esterase enzyme. Okay. Okay. So number one, these are first of all acetylcholine itself, methacholine, bethanicol, muscarine, and pilocarpine. Okay, we're just doing classifications right now, and later on at the last part of the video we'll discuss something about these drugs. Okay, the second type, that is those drugs that inhibit the acetylcholine esterase enzyme and thus increasing the concentration of acetylcholine. These are of two types. Okay, these are that reversibly target the acetylcholine esterase and irreversibly target the acetylcholine esterase. Okay, the reversibles ones are physostigmine, neostigmine, pyridostigmine, and hydrophonium. Okay, and the irreversible ones are organophosphates, that includes parathione, malathione, tabun, sarin, and organocarbamates. Okay, example, carboxyl, propuxur. Okay, it is this one was difficult for me to pronounce. Okay, PROPOXUR. Okay, these are the cholinergic agents, and now we'll discuss action, both muscarinic action and nicotinic action of acetylcholine throughout the body. Okay. Okay, now we'll discuss about the muscarinic actions of acetylcholine on various organs. Okay, first of all, let's start with the eye. Okay, as we discussed earlier, that eye has the M3 type of muscarinic receptor. Okay, when acetylcholine acts on M3 receptor of the eye, it causes contraction of circular muscles of the iris. Okay, contraction of circular muscles of the iris, thus causing miosis. Okay, miosis means small, the pupil becomes smaller in size, smaller diameter of, or constricted pupil. Okay, it was also difficult for me to remember which one of the miosis and mydriasis is constricted pupil. Okay, the miosis is composed of small. It is a relatively smaller word in compared to mydriasis. Okay, let me write mydriasis. MYDRIASIS. Okay, I used to remember this like this, as the bigger word means bigger pupil. Okay, smaller word means smaller pupil. Okay, it causes miosis, and it also causes the contraction of ciliary muscle, thus causing accommodation for near vision. And okay, this contraction of ciliary muscles also cause reduction of intraocular pressure, especially in those patients that have glaucoma. Okay, moving on to lungs, it also has M3 receptors. At the last of this video, or maybe in between, I'll give mnemonics on how to remember these things. Okay, in lungs, the activation of M3 receptors cause contraction of bronchioles. Okay, thus causing bronchospasm that may lead to dyspnea, or it may precipitate attack of bronchial asthma. Okay, therefore asthmatics are highly sensitive to stimulation of M3 receptors. Okay, it also increases secretions, that is tracheobronchial secretions. Okay, now moving on to gastrointestinal system, there are two type of receptor, M1 and M3. The M1 is present on stomach and intestine, and the glands, that is, they have M3 receptors. Okay, so the effects are stimulation of parietal cell occurs, which increases hydrogen ion synthesis, causing increased acidity and thus gastritis. Okay, there occurs in increased motility of the intestines, and it may cause intestinal cramps. There occur relaxations of sphincter, causing involuntary defecation, and contraction of intestine that may also cause involuntary defecation. Okay, as I already said, these causes increase secretion from the gastric glands. Okay, this is done. Now bladder, it also has M3 receptor. Okay, most of the smooth muscles have M3 receptor. Okay, it causes the contraction of detrusor muscle and relaxation of the trigon and sphincter, thus causing voiding or urination. Okay, voiding or urination. Okay, let me remove this. Okay, now we'll discuss about what are the effects of muscarinic stimulation on the heart. Okay, on the heart, the heart has M2 receptor. Okay, let me draw heart first. Okay, the heart is red. Okay, muscarinic receptor M2 is present on the heart. What it does is it causes, as we discussed earlier, it causes vagal mediated bradycardia. One, and second, it also decreases the conduction velocity by AV node blockage. Okay, so it has two things on heart. Hyperpolarization of SA node leads to bradycardia, and partial or complete inhibition of AV node leads to conduction blockage. Conduction blockage may lead to heart blocks also. Okay, the next one is blood vessels. The blood vessels also have M3 receptor. Okay, these cause dilation of blood vessels by formation of an enzyme called nitric oxide and endothelium derived relaxing factor. Okay, remember that the blood vessels do not have any direct innervation, therefore no effect of indirect agonists. Okay, and so okay, blood vessels, and okay, let me write M2, let me write M3. Okay, sphincters. Now sphincters. Okay, stimulation of sphincters cause by muscarinic action cause relaxation of the sphincters, except the lower esophageal sphincters, which contracts. Okay, sphincters except lower esophageal sphincter, it contracts. Okay, and the glands. Now lastly, glands have, okay, let me draw glands like this. Okay, these are glands have M3 receptor. Okay, secretions are increased when muscarinic stimulation is there. Okay, like salivation is increased, increased sweating, increased lacrimation occur, increased lacrimation. Okay, so I'll tell you now how to remember these things. Okay, remember that remember that the parasympathetic nervous system is a nervous system of rest, digest, and eliminate. Okay, the parasympathetic nervous system. Okay, let me use a different color. The parasympathetic, again, let me use a different color. The parasympathetic nervous system, rest, digest, eliminate, eliminate. Okay, if you remember it this like this, okay, then it will be very easy for you. And the sympathetic nervous system is a nervous system of fight, flight, and fright response. Okay, we'll discuss those later, but let's correlate these. Okay, when you're resting and you're at ease, then what you want is you want to digest your food. You can go for defecations because you have all these free times, and you do not mind if even if your sphincters relax. Okay, so this about GI, about the gastrointestinal system. Okay, uh, okay, same with the bladder, same with the heart. At resting, there is bradycardia, and okay, just correlate. It's a kind of a mnemonic like. Okay, rest, digest, and eliminate. Okay, this will correlate much better when you will discuss the adrenergic effects. Okay. Okay, let me give an example that suppose if a tiger is running after you, okay, means your body should be in flight, fright, and fight response. Okay, means that the sympathetic nervous system will activate. Suppose if muscarinic system was acting there and your eyes were in the state of meiosis or your pupils were constriction, then you would not be able to see very far because they will be accommodated for near vision. Then you could not see possible ways or possible site to escape or possible site to hide from the tiger. Okay, at the same time, if bronchospasm happens and in there are increased tracheobronchial secretions, then you would not be able to run properly because you could not breathe. You will be out of breath. Okay, similarly, if your heart is not supplying adequate blood to your muscles due to low heart rate, then you cannot run away from that tiger. Okay, and I think uh, okay, next we'll discuss about the nicotinic actions. Okay, moving on to the nicotinic actions. Okay, when acetylcholine stimulates the nicotinic receptors, okay, we all know that the nicotinic receptors are present in autonomic ganglia, neuromuscular junction, and adrenal medulla. Okay, let me remind you that NM, NM, okay, yeah, N, 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 and N, M. Okay, remember these. Okay, okay, both sympathetic, sorry for that, both sympathetic and parasympathetic autonomic ganglia, they are stimulated by acetylcholine if they act by the nicotinic receptors. Okay, this effect is usually seen at higher doses. Okay, for example, there is one example that high dose of acetylcholine given after atropine causes tachycardia and rise in BP due to stimulation of sympathetic ganglia and release of catecholamines. Okay, then at neuromuscular junction, if stimulation occurs, then there is twitch hypersensitivity of skeletal muscles, causing twitching of muscles. Then the third one is adrenal medulla. When there is stimulation, there is secretion of epinephrine and norepinephrine and their respective actions. Okay, there is one more point that I think I forgot to mention on the muscarinic receptor, that effect of muscarinic receptors on CNS. Okay, so mainly effect of acetylcholine on CNS. Okay, acetylcholine, when injected intravenously, does not penetrate the blood-brain barrier. Therefore, no any central effects are seen. But if somehow we can give direct injection into the brain, then it produces firstly arousal, then followed by depressions. Okay, so the cholinergic drugs which enter brain, which can enter the brain, which can cross the blood-brain barrier, produce very complex behavioral and neurological effects. Okay, next we'll discuss uh, few thing about some of the drugs that we have already named and classified. Okay, and after that we'll conclude the cholinergic, and then we'll discuss about the most important thing, that is the side effects of these drugs, known also famously known as the dumbbell. Okay. Okay, now we'll discuss about few things about these individual drugs or agents. Okay, first I remember that there were two type of cholinergic drugs. Okay, the first one that directly acted on the acetylcholine receptor, and the second one that increase the concentration of acetylcholine by inhibiting acetylcholine esterase. Okay, so we'll discuss those first topics like muscarinic agonist first. Okay, acetylcholine, it has both nicotinic and muscarinic activity. Okay, it is a boss. Our whole discussion is based on this acetylcholine. Okay, uh, it has no clinical use. Okay, no clinical use because it has very short half life. Okay, no clinical use because it has very short half life. Okay, the next one is okay. One important point is that both true and pseudocholinesterase enzyme can hydrolyze acetylcholinesterase. Okay, next is beta-nickel. Okay, it has selective muscarinic activity on both gastrointestinal system and genitourinary system. Okay, therefore we can use this beta-nickel in one post-op urinary retention, post-op urinary retention. Okay, what beta-nickel does is it contracts the detrusor muscle and relaxes the sphincter and trigon. So it contracts these muscles, detrusor muscles, and it relaxes the sphincter. So what happens is your urine starts flowing, thus used in post-operative urinary retention. And the second point where this is used is uh, ileus, in paralytic ileus. Paralytic ileus. What beta-nickel does is it stimulates the peristaltic movement and increases the tone by acting on AMP3 receptors. Okay, and again same in opposition to acetylcholine, both the true and pseudocholinesterase enzyme do not act on beta-nickel. Okay, the third one is pilocarpine. It has both muscarinic and nicotinic action, but the predominant action is muscarinic effect, and that mainly on secretory, where there is more secretory activity happening. Okay, so the uses are xerostomia. Xerophthalmia means dry mouth, dry eye. Okay, the second important use is open angle glaucoma and acute congestive glaucoma. Okay, generally 0.5 to 4% solution of topically. That is topically. Okay, what happens is that pilocarpine causes miosis by contracting the sphincter pupillae muscle. It also opens the trabecular meshwork around the Slem's canal, thus facilitating aqueous humor drainage and decreasing ICP. Okay, decreases ICP, thus used in this. Okay, the fourth one is muscarine. Okay, I wrote it because it is one of the most important component of poisonous mushrooms. Okay, that is the only reason why I wrote muscarine here. Next we'll discuss about the indirectly acting or acetylcholine esterase inhibitors that increase the concentration of acetylcholine. Okay, used in war, they used to be used in wars. Okay, as nerve gas, mainly sarin type. Okay, uh, the one important thing about the reversible acetylcholine esterase inhibitors are that they inhibit both true and pseudocholine esterase reversibly. Okay. Mm, okay. Now it's time for the famous dumbbells. Okay. A dumbbell is a mnemonic that helps us to remember the toxicity of acetylcholine esterase inhibitors. Okay. So if someone is coming with organophosphate poisoning, which is very common in my country, okay, then look for these signs. Okay, and always remember that tiger or the rest, digest, and eliminate response. Okay, so first one, D, is diarrhea. Okay, it increases the gastric peristalsis and causes relaxation of sphincters, causing diarrhea. Okay, second one is urination by contraction of the detrusor muscle and also by relaxation of the trigon and sphincter. Okay, the third one is myiasis by contraction of the ciliary muscle of iris. It causes constriction of the pupil known as myiasis. Okay, vagally mediated decrease in heart rate, also known as bradycardia. Okay, a spasm of the bronchial smooth muscles causing bronchospasm, and bronchorrhea or increase in secretion of bronchial glands. Okay, L stands for lacrimation. Okay, E for emesis, vomiting, means you will be throwing out of both ends. Okay, and another one is salivation, S, and S, the last S is for sweating. Okay, remember dumbbells. You can either remember also the tiger or rest, digest, and eliminate, and flight, fright, and fight response. Okay, I think this concludes the cholinergic agents. Next we'll discuss about the anticholinergic agents. Okay.